Welcome to KS Medical Coding Academy. In this lesson, we begin our 2026 CPT Surgery section for CPC exam preparation. The surgery section covers captain codes from 10,000 through 69,999 and is organized by major anatomical and procedural areas. In this series, we'll learn how to identify the correct surgical code by understanding the anatomy, procedure, technique, guidelines, and documentation. We'll also focus on important 2026 CPT updates and CPC exam concepts. Let's begin our journey through the surgery section. Before we begin, let's look at the objectives for this lesson. By the end of this lesson, you'll understand the captain surgery section, identify the major surgical code ranges, and understand how surgical captain codes are organized. You'll also learn a basic surgical coding workflow and recognize important 2026 CPT changes. This lesson is designed for educational and CPC exam preparation purposes. CPT codes and guidelines can be updated, so always verify code selection using the current captain codebook, applicable CMS guidance, and payer-specific policies before professional coding or billing. Now, let's begin with the foundation of the captain surgery section. Now let's understand what the captain surgery section is. The surgery section contains captain codes used to report many surgical procedures and related services performed by physicians and other qualified healthcare professionals. CPT provides a standardized language for describing and reporting medical procedures. The surgery section is organized primarily by anatomical system and type of procedure, covering areas such as the integumentary, musculoskeletal, cardiovascular, digestive, genitourinary, nervous, eye, and auditory systems. As a CPC coder, remember this simple sequence. Where is the procedure performed? What procedure was performed? How was it performed? Which captain code applies? And what guidelines or instructions must be followed? Most importantly, your code selection must be supported by the medical record. CPC memory tip. Code what was performed, supported by documentation. Now let's look at the major captain surgery code ranges. The surgery section spans 10,000 through 69,999 and is organized into 6 major anatomical groupings. 10,000 through 19,999 covers the integumentary system. 20,000 through 29,999 covers the musculoskeletal system. 30,000 through 39,999 covers the respiratory, cardiovascular, hemic, and lymphatic systems. 40,000 through 49,999 covers the digestive system. 50,000 through 59,999 covers the urinary system, male and female genital systems, and maternity care and delivery. Finally, 60,000 through 69,999 covers the endocrine, nervous, eye and ocular adnexa, and auditory systems. For CPC preparation, remember the simple pattern: 100, skin, 200, bones and muscles. 300, respiratory and cardiovascular. 400, digestive. 500, genitourinary and maternity. 600, endocrine, nervous, and sensory systems. Remember, these are major code ranges, not a statement that every number within the range is an active or billable code. Always verify the specific captain code and descriptor in the current codebook. Now let's learn how to navigate and organize surgical captain codes. Start with the section, then identify the appropriate subsection or anatomical system, followed by the relevant code family or range. From there, locate the specific captain code and read its complete code descriptor. Before finalizing the code, always review the applicable guidelines and parenthetical instructions. Also watch for add-on codes, which are reported in addition to an appropriate primary procedure, and use cross-references when the captain codebook directs you to another code or related code family. For CPC preparation, remember 4 simple steps. Find right pointing arrow, read right pointing arrow, check right pointing arrow, verify. Find the code family, read the complete descriptor, check the guidelines and instructions, and verify the final code. The key lesson is simple: never select a surgical captain code from the procedure name alone. Now let's apply a simple 3-question approach to surgical coding: where, what, and how. First, where? Identify the anatomical site where the procedure was performed, such as the skin, bone, heart, digestive organ, kidney, eye, or another documented site. Second, what? Identify the actual procedure performed. Common procedure concepts include incision, excision, resection, repair, removal, destruction, and reconstruction. Third, how? Identify the technique or approach when it affects code selection, such as open, percutaneous, endoscopic, laparoscopic, or arthroscopic. Remember, the procedure describes what was done, while the approach describes how it was performed. For CPC preparation, remember, where right pointing arrow, what right pointing arrow, how right pointing arrow, code right pointing arrow, GUIDELINES. Always use the operative documentation to support the final code selection. Now let's understand why surgical guidelines matter in CPT coding. When selecting a surgical code, don't look at the code descriptor alone. Start by reviewing the section guidelines and subsection guidelines that apply to the procedure. Next, check the code-specific instructions and parenthetical notes. These may provide important directions about when a code can be reported, when another code should be used, or when two services should not be reported together. Also pay attention to add-on code instructions and the separate procedure convention. A procedure identified as a separate procedure is generally not reported separately when it is an integral part of another related procedure, unless the applicable CPT guidance supports separate reporting. Finally, make sure the documentation supports the service actually performed. For CPC preparation, remember this sequence. Descriptor right pointing arrow, guidelines right pointing arrow, parentheticals right pointing arrow, documentation right pointing arrow, CODE. The key rule is simple: never select a surgical CPT code from the descriptor alone. Now let's look at a simple surgical coding workflow that you can use for CPC exam questions. First, start with the documentation and determine exactly what was performed. Next, identify the anatomy or surgical site, followed by the procedure and the documented technique or approach, when relevant. Then locate the appropriate CPT code family. Before selecting the final code, carefully review the applicable section and subsection guidelines, code-specific instructions, and parenthetical notes. Next, check NCCI edits, bundling rules, add-on code requirements, and modifiers when applicable. Remember, modifiers should only be used when the documentation and coding rules support them. Finally, select the most appropriate CPT code supported by the documentation and applicable guidelines. For CPC preparation, remember, document right pointing arrow, where right pointing arrow, what right pointing arrow, how right pointing arrow, find right pointing arrow, read right pointing arrow, check right pointing arrow, CODE. This workflow helps you approach surgical coding questions systematically and avoid common coding errors. Before we move into specific surgical systems, let's introduce some important concepts that every CPC should recognize. First, the global surgical package involves services that may be included in the surgical payment. We also need to understand multiple procedures and bilateral procedures, along with add-on codes and the separate procedure convention. An unlisted procedure code may be appropriate when no specific CPT code adequately describes the procedure performed. Next are surgical modifiers, which provide additional information about the circumstances of a service. We also have assistant surgeon, co-surgeon, and team surgery concepts. These have specific reporting requirements that we'll study in later lessons. Finally, NCCI and bundling rules help determine whether certain procedures can be reported together. For now, remember that these concepts do not apply to every surgical case. Always follow the applicable CPT guidelines, documentation, payer rules, and NCCI policies. We'll cover each of these concepts in detail later in the surgery series. Now let's look at some important 2026 CPT updates. The 2026 CPT code set includes 418 total changes, 288 new codes, 84 deleted codes, and 46 revised codes. These numbers represent changes across the entire CPT code set, not just the surgery section. One of the major surgery-specific updates is the comprehensive revision of lower-extremity revascularization, or LER, coding. In 2026, the previous LER codes were deleted and 46 new LER codes were introduced to modernize reporting and reflect advances in technology and current approaches to care. For this introductory lesson, you do not need to memorize the detailed LER codes. We will cover those changes separately in our dedicated 2026 lower-extremity revascularization update lesson. For CPC preparation, remember, 288 new, 84 deleted, and 46 revised, 418 total CPT changes. Most importantly, always verify code selection using the current Captain code set, applicable guidelines, CMS guidance, and payer requirements. Let's apply what we've learned with a simple CPC scenario. A coder identifies a surgical procedure from the operative documentation and selects a Captain code based only on the procedure name. The coder does not review the applicable surgical guidelines or parenthetical instructions. What is the major coding error? The answer is failing to review the applicable guidelines and instructions before final code selection. Remember, finding a familiar procedure name does not automatically mean you have found the correct Captain code. Before finalizing your code, review the complete descriptor, applicable guidelines, parenthetical instructions, and supporting documentation. For CPC preparation, remember: anatomy, right pointing arrow; procedure, right pointing arrow; technique, right pointing arrow; guidelines, right pointing arrow; CODE. And our key lesson is simple: read right pointing arrow, verify right pointing arrow, then code. Good medical coders don't guess. They follow a systematic process and support their code selection with the appropriate guidelines and documentation. Let's conclude our introduction to the Captain Surgery section for 2026. The surgery section covers Captain codes 10,000 through 69,999 and is organized into 6 major surgical system ranges. When approaching a surgical coding question, first identify where the procedure was performed, the anatomy or surgical site. Next, determine what procedure was performed, and then identify how it was performed, including the documented technique or approach. Before finalizing a code, always review the applicable Captain guidelines, instructions, parenthetical notes, and coding conventions. Also consider bundling and modifiers when they are applicable. The global surgical package is another important concept that we will study in detail later in this series. For 2026, one major surgery section change is the comprehensive overhaul of lower extremity revascularization, including 46 new Captain codes. So remember your final CPC coding sequence: where right pointing arrow, what right pointing arrow, how right pointing arrow, guidelines, right pointing arrow, code, right pointing arrow, modifiers. This sequence gives you a structured way to approach surgical coding questions instead of selecting a code simply because the procedure name appears to match. With that, Lesson 1, Captain Surgery Section Introduction, 2026 is complete. Next, we move to Lesson 2, How to Read Surgical Captain Codes.